a quick fix. It sounds like it needs a lot more dedication and work. What would you like to share on that comment?
Bonnie, definitely it's a lot of dedication and commitment. It's a lot of tears. The first, like I mentioned, the first 2-3 years, it's very difficult. It's a lot of mental struggle. It's a lot, man. But I think, would I do it again? Yes, I would do it again. Believe it or not. I know the last time I was very unsure when I was on the show, but right now, given the chance to do it again, I would absolutely do it again with all those challenges. I would. And I feel like as you grow older, you also realize that life is hard, and in any situation, even the good things are still hard, You just have to choose your heart. So I feel like, yeah, it's a lot of work, absolutely.
A question from Gilebogile Mgoe 502 from TikTok, who asked, is this safe though? Is this safe?
I think it is safe with who you go to, like the doctor you go to. You need to do your research. So also, guys, I don't want to sit and say, I mean, I've heard stories where other people have had situations or issues, but what I've also realized that a lot of people cut corners with their doctors. I think the first red flag is if your medical aid doesn't want to pay the doctor. That is a serious red flag, because medical aid does a lot of due diligence for you. They would never pay a doctor. They would never want to pay a doctor that's good, right? So your doctor, I'm fortunate that my doctor is extremely thorough. She's extremely thorough. She's very protective of her space, and sometimes comes across as is closing up for other people. But when I got sick, she looked at my tests, and after my test results came back, when I tell you, I've never felt tired for the last 8 months since I got ill in February. I used to get so tired. I've never taken vitamin B12 injections or anything. I'm just drinking my vitamins. And my energy levels is insane. My skin, I don't wear makeup anymore because my skin, my pimples are gone. She checks everything to the T and how everything works together, potassium, this and that. I drink a lot of vitamins, but I'm feeling so good. For example, another one, talking about safety, she picked up that my calcium intake is super low, right? Remember, the stomach is small, so my food, the amount of food I get is not enough. Yeah, absorption is not enough, right? So which then means that my calcium intake is really low, because remember, I also don't drink milk because I'm lactose intolerant, right? So when I do drink milk, it's when I need it. Then I do take supplements for calcium. However, my supplements are not getting absorbed too well. So the calcium supplement is not getting absorbed, and my vitamin A is not getting absorbed. So what she's now doing is that, as part of the corrective measures, which I still go see my doctor twice a year, she then put me on, I'm going for what you call bone density test, right? To minimize me getting osteoporosis later on.
Osteoporosis, yes.
Osteoporosis, yes. So she can tell that if she doesn't do anything with it now, I will have osteoporosis. And whereas I don't have children, and later when I want to conceive, you don't want to have issues of bones. So what are we doing now? She then put me I'm going for a bone density test, which will then look at my bone density and what I need. Then based on the results that come out, I'm going to go for a bone density treatment, where I will then see a specialist who works with bones, right? And I'll be given treatment. So this is the kind of doctor I see. When I had I don't even go for IV drips now because my vitamins are so good. Another example, earlier this year, I had vitamin A issues. I didn't know vitamin A plays such a big role in your body. My eye started tearing itself, right? Went to the ophthalmologist, where they picked up that my eye is not great. Put me on treatment, but the doctor did not run tests there. When I saw my endocrinologist, she picked up that my vitamin A is not being absorbed well, which then means that my absorption is not well. She looked at my stomach length in terms of the gas in my pus when they were sorting the length of absorption. She then said, okay, your stomach length is sitting at about 100 centimeters or 100, I can't remember exactly. But based on that, it means your vitamins are not being fully absorbed, which means next year, we're doing the last 6 months to see how I'm absorbing. End of January, I will go back to theater to increase the length of the absorption rate. Because if it's too short, it means I'm going to have recurring issues. But this is 5 years later. I'm doing 5 years in January. So 5 years later, she then picks up that, man, vitamin A is not getting absorbed. Calcium is not getting absorbed. There is a problem. She put me on a higher dosage of vitamin A medication. I take about 5 pills of vitamin A. But she wants to see, is the problem the length of the stomach? And if that's the problem, we're still not absorbing. In January, I'll go back to theater and she will increase the length of the stomach so it absorbs fully.
So if the length of the stomach is increased for higher absorption, does that not increase now the rate of what would be weight gain? So what does that mean for how your lifestyle would need to change if you want to remain on a maintenance plan?
So I asked the same question as well. Does that mean I'll gain weight? She said, not so much. No, of course, I think, obviously, I think she had to say to me that I'm not going to gain weight. I personally, because people don't share this part of the surgery. Like, no one will tell you. I mean, people are probably going to be like, she has to go back and extend her length. Nobody tells anybody that. I've never met anyone who actually, and a lot of people struggle with malabsorption and they actually go back, but they don't tell you. So I do think, yes, to some extent, there probably will be a weight gain issue because the absorption has changed. However, the intake of food is still going to be very small, right? And obviously now, knowing that I would have extended the length of absorption, it means I must now also be aware, right?
Yes.
But the weight gain will never be going back to 195. It will never be that bad, and also, I think the difference with me, I'm not attached to weight anymore. So even if I gain an extra 5 kgs, it's fine. I'll figure it out. Yeah. So that's the safety part, the issues I'm faced with right now in terms of the surgery, but they don't stress me at all because my medical aid is going to cover the surgery 100%, the extension of the absorption, my maintenance of it. I still go to the doctor consistently, and she is very thorough, extreme. I mean, I'm telling you these things. She sits there and literally goes through your blood test line by line.
Yeah, Liago, I think it's so interesting that you've been sharing with us. It's not a once-off event where like boom, it's done. It's an ongoing journey, and especially with your health. And I really hope that the procedure goes well when you get to that point, and that things are going to be fine with your bones, with your intake and absorption of things like your vitamin A and your calcium, and that you don't develop any more problems going forward. But thank you so much for coming to catch up and to bring us up to date with where you're at